I'm joined here with Dr. Jagdish Shah. So, what is the reality? How prevention is actually important?
But iatrogenicity is a mistake of a doctor. The wrong medicines are given, and the patient has some severe side effects, and the patient gets into ICU, spend lakhs, and dies.
Why prevention is so much neglected in the modern health now?
If these people,
Everyone adopted holistic lifestyle change since childhood, and how that can change the future health.
they have lack of parenting, meaning the child, both husband and wife working, child is with caretaker, and that is the root cause of adult problem.
I'm joined here with Dr. Jagdish Shah, who is an holistic healthcare expert practicing from more than 45 years. Dr. Shah is actually passionate about mixing modern health and ancient health together and promote wellness. So welcome, Dr. Shah. It's pleasure having you here.
Thank you.
So let's start by discussing a topic we often overlook: prevention. Frequently, we only consider our health when we become ill. So, what is the reality? How prevention is actually important?
So, good morning, ladies and gentlemen. Well, this topic, which is raised by Apurrva, first of all, at the outset, it's my pleasure, privilege, and honor to be talking on this particular subject of lifestyle and comparing it with modern medicine. So, I must thank Dr. Apurva for her initiative on this healthcare and her interest. I really congratulate her. So, coming to your question now, we have two broad categories of medical issues, say diseases. One is communicable disease, say for example typhoid, COVID, whatever, jaundice. They are communicable. Means supposing I am getting influenza and I sneeze, you will get influenza. That's called communicable. And there is another group of diseases which are called non-communicable disease. So this we cannot communicate. So for example, I have got diabetes. You will not get diabetes when you are sitting with me. So these are non-communicable disease. And the burden of non-communicable disease, if you have to understand, is more than 60 to 75% all over the globe. And these non-communicable disease are now increasing because communicable disease like infectious disease, we have got good control with antibiotics, with modern therapy. In fact, this modern therapy is very good in communicable disease. Whereas this non-communicable disease, what we call it as NCDs, the treatment is lifestyle. So I remember there was a lady, I forgot her name, in Bollywood. She was asked what is cinema, and she said entertainment, entertainment, entertainment. I'm forgetting the
Vidya
name.
Balan.
Vidya Balan, yeah. So now in medicine, if someone is asking me today, I'm practicing for last more than 45 years. At that time, the things were different. Communicable diseases were there, people were dying because of that. Now it's a reverse phenomena. And today, if someone is asking me about this non-communicable disease, okay, I always say three things: lifestyle, lifestyle, and lifestyle. So, if you have better lifestyle right from the beginning, okay, that will come to later when your other questions come up, then probably we can avoid modern medicine as much as possible, and that should be the target. Why? Because modern medicine has got lots of side effects. It has got effect, but it has got lots of side effects. So there are two main issues of modern medicine. Number one is what we call it as ADR, and the two is iatrogenesis. Now, when I talk to you as a layperson, say you say I have got this problem, sir, but I'm getting the other problem. I'm getting cough, but you've given me the tablet. I'm getting sleepy. I'm drowsy. I can't drive. Now, this is an ADR, okay, adverse drug reaction. The second thing is, supposing this adverse drug reaction is in severity, more severity. You have to go even to some people, we have to send them to even ICU and they die. This is called iatrogenicity, meaning it's a beautiful word. when I say iatrogenic, you feel that it's a disease and that's why the person has died. But iatrogenicity is a mistake of a doctor. The wrong medicines are given, and the patient has some severe side effects, and the patient gets into ICU, spends lakhs, and dies. This is iatrogenicity. So the idea is, even if I am a medical doctor, when over a period of last so many years when I'm practicing, I feel that this ADRs and iatrogenicity has to reduce considerably. And then I use my knowledge of alternative medicine. I've specialized in acupuncture, and we try to see that initially with lifestyle and all this lifestyle medicine, what we call it as alternative medicine, like homeopathy, like naturopathy, Ayurveda, acupuncture, Inani, Tibetan, Chinese, TCM, whatever. So we try to use scientifically. Not there are quacks also in these things, and they spoil your name. But if you use them scientifically, okay, you can achieve a reasonable amount of cure, and you can avoid these medicines, their side effects, their ADRs, and their heterogeneity. And the cost is reduced considerably. Because what happens is, any person who gets a sickness in the family, they immediately get anxiety, severe anxiety, and they consult some doctor and then they hospitalize. And what now the simple problem can be solved by your knowledge, by your proper use of alternative medicine, and your judgment. Say, for example, someone gets unconscious, and the relatives at home, daughters, and they get severe anxiety. The person is transferred to ICU. ICU doctor takes cardiogram, and then cardiogram shows some changes, and they are doing angiography, and that, and then minus 1, 2, 3, 4 lakhs, and person dies or person comes out with a heavy penalty. Now, this simple thing, if a proper doctor has judged it properly and found out that, okay, this unconsciousness was because of low sugar, and corrects it right at that time, then probably the person is saved, life is saved, the money is saved. And that is what is the idea about holistic health, about comparing modern medicine versus alternative medicine. Now, the second thing is, if you see the corona time, we are on the fifth year now. We are just, I think 2020 we had, and 2025 we are now. So these 5 years of corona, we have learned a lot many things in medicine, because when corona started, it struck the whole world, whole globe. We had no clue. In fact, even in modern medicine, we had no clue what is to be done next. We were just experimenting, very honestly, on the patients and trying. It was trial and error medicine at that time, because it's a new disease, new infection, new virus. No one had any clue. So everyone jumped into it, alternative medicine, even Ayurveda, even homeopathy, even everything. And they were trying and sort of thinking that our medicine, and there were big claims by everyone all over the across the thing. So what I personally felt during that time, if I was actually consulting on telephone more than 100 patients a day that time, and what I found, that neither naturopathy nor homeopathy nor allopathy, but the sympathy was working very well. So this sympathy, combined with modern medicine, combined with some kind of alternative medicine like acupuncture, works tremendously well. So now, if you take corona and just one disease, so I'll elaborate on it, and then you'll understand what is the impact of it on society in general. So during corona time, those people who had no diabetes, no blood pressure, no alcohol, no smoking, no nothing, they had corona. They were positive, RT-PCR positive, but they survived. They didn't go even to hospital. Nothing happened except for minor cough, some 2 days of fever, and they survived. Now, there were some people who had diabetes, blood pressure, and they had this COVID. Additionally, they had obesity and all. These people had to go to hospital. They were in hospital. They spent some few lakhs. They come out. Then there is a third group where they had diabetes, they had blood pressure, they had cholesterol, these three lethal trio. They had some of them, they had asthma, some of them had liver problems, some of them had kidney issues, some of them had drugs. So these are the people on top of all these comorbid conditions, what we call it in medicine, they had additionally smoking and alcohol and probably drugs in some subgroup. These are the people who went to ICU and they succumbed, they died. So, bottom line is if you have diabetes, if you have blood pressure, if you have cholesterol, if you have smoking habits or dirty habits, whatever it is, alcohol, forget about COVID. All other diseases, the severity, say for example, influenza, it's a common cold, but the severity will be more in these people. So, the whole idea is to see to it that you control these particular things, the trio of six: blood sugar, hypertension, cholesterol, smoking, sugar, and smoking, alcohol, and stress. If you these six things, if you can control, and this control will never come by medicine, it will come only by lifestyle initially. That subsequently you will have to add some medicine. That is a different story. So, Apurva, if you have to understand further, then we could, or rather, we invented vaccine, Covishield and or Covaxin, and then people survived. Most of the people survived all over the globe, thanks to our Prime Minister Narendra Modi ji. And if you go further, a step further, then these vaccines saved. Now there are other vaccines which are available for common cold, say influenza, or for pneumonia, or for typhoid, or for jaundice, or even for Shingrix, that is herpes. But these are called preventive medicine or lifestyle, what we call preventive. Herpes are preventive medicine. They prevent diseases. But in spite of repeated reminders, in spite of repeated requests, no one takes it. For what? I've yet to understand. So idea is now that control these lifestyle diseases, get yourself vaccinated completely. Say for example, 40, 50, 60, 70 years back, our grandfathers and great grandfathers, they had 10, 12, 15 children. Why? Because they were dying. Most of them, they were dying. The pediatric death ratio was very high at that time. Now no one dies. Why? Because of this pediatric vaccination. So we have this pediatric vaccination chart and we give religiously to our children, and this has happened over a period of time. And when we give this kind of pediatric vaccines, the children, they survive. And now you and me, all of us have one or two kids probably. Why? Because we know, we are certain that children are going to die. So that's number one. Number two is, as we have pediatric vaccines, we have adult vaccines, as what I just communicated to you. And these vaccines, if a person or in general the government makes a rule like pediatric vaccine, gives them free, I think India will survive, become healthy. On top of that, the expenses to the healthcare will reduce drastically. That is what my message to our government. Thank you very much.
Actually, correct, doctor. I am a mother, so as a kid, there's a proper chart wherein we follow कि इस महीने में ये देना है, 3 months में, 6 months में.
Sure.
So we religiously follow it. But when we grow up, we don't pay so much attention to the vaccines. In fact, during the COVID, also many of them refuse taking vaccines, that it is not required. So yes, this is a good point we should take in consideration. Doctor, I wanted to ask you, what are the small and preventive habits that people should undertake so that they are away from illness?
So let me tell you that there is something like doctor shopping, a phrase which is created recently. I don't know whether you're aware or not.
Doctor shopping.
Doctor shopping. So, you have to buy something, say for example, salwar or pant or something or jewelry. or accessories. You go to Linking Road, okay, and then this is not good, the texture is not good, the money is not good, the color is not good. You can buy, you can shop and do whatever you want as far as your other things are concerned. Now, what has happened? The same thing has percolated into health. There is a doctor shopping, they go to a doctor, then find out what is it. Okay, they are satisfied, not said, they go and consult someone, then they consult or rather go on to Google universities, WhatsApp university, try variety of things, and then they are confused at the end of the day what to do, how to do. And this doctor shopping becomes very, very dangerous to their health. So I tell you all, the audience who is listening to me, that please stop doctor shopping. Once you, first of all, you find out which doctor you want to go, and then continue with his or her advice, because Google and WhatsApp cannot treat you. That is what my message to you people. So your second question is very important, and that I would answer this way, that God Almighty. Okay, now we have this air conditioner, right? We have these machines, whatever are gadgets here. We service them, right? And we have what we call it as annual
AMC,
maintenance
annual maintenance.
contract like things, you know. And once you buy this machine, say for example air conditioner, you have warranty and guarantee. So guarantee is 1 year, nothing to worry, nothing will happen. And what is warranty? 2 years warranty, but it will come with some small italics, that some conditions that you have to use like this, and you cannot put in water and you can do this, so many things. Same thing, this human, this is a machine, all right? We have bought or rather got from God. Now God has given you a guarantee and warranty because this is a machine, so God is given you. I know that. So what is that guarantee and warranty? Because I've seen it in my practice for last so many years, that whatever you do, whatever you drink, you smoke, some junk food, anything, alcohol, smoking, do anything, you are going to survive for 60 years. All right? Whatever you do, nothing, you can't die before 60 unless you meet with some accident or something. So you are going to live for 60 years. That is guaranteed. Okay? Whatever you do, no conditions. The second part of it, say consider God has given you 100 years, right? So now, how many years are balanced? 40, correct? So now 40 is a warranty, conditions apply, right? Now, so what are these conditions? So 10 years of your life is depending upon your genetics, your parents. Your parents had heart attack or what, we do not know, and we cannot choose our parents. So 10 years you forget. So what it comes to?
30.
90. So 60 guarantee, 60 and 90 warranty, right? Now these 30 years, you understand, I gave you 6 point: salt, oil, sugar, or diabetes, blood pressure, cholesterol, right? And smoking, alcohol, and stress. You give 5 marks. How it become 30, right? Now, if you have to understand, you are smoking or someone is smoking, so he will die 5 years early. So what it comes to, figure comes to 85. Drinking, 80. Salt, oil, sugar, again minus 30, it comes to 65. And stress, 60. Finished. You getting it? So this is the law of death, what we call it, or what I have designed that law of death. If someone comes to me, I guess, okay, he has got 3 factors, he is going to go at 75. He is all 6 factors, he is going to go at 60. I have in my mind, I counsel him and I tell him, most of the time it works beautifully well, but sometimes we cannot just help them. So this is number one. Number two, what I personally feel is that there are people, so they mimic, they say that, yeah, XYZ is taking alcohol, XYZ is smoking, this fellow is having junk food, his sugar is so high, nothing happens to them. So I always tell them one thing, that you see a lady in the circus, she is moving from one rope to the other, from one end to the other end with the rope, without any support. There is nothing on the ground. And still they survive. All right. Are you one of them? and then they understand, because finally there are some exceptions everywhere, all over, and these exceptions we have to accept. I mean, you can't just say because someone is doing this, because someone's sugar is 300, my sugar is 250, I am better. Nothing of that sort.
So, doctor, in health, actually, 1 plus 1 is not 2
Absolutely
because everybody is different.
different. So there are some subgroups, but you cannot follow them. That way, I always give an example of our beloved Prime Minister Narendra Modi. He gets up at 3 o'clock and works for almost 20 hours. So can you do that? Are you doing that? Then nothing of that sort.
So, doctor, what do you feel exactly? I mean, why prevention is so much neglected in the modern health now?
So what we call it as cemetery mortification. You know what is cemetery mortification? You know cemetery,
Yeah.
right? Mortification is vairagya. Okay, smashan vairagya actually. So if someone dies and you attend the cemetery, uh, कैसे मर गया? No, he had severe diabetes. Oh my God. So what to do? From tomorrow I won't add sugar. कैसे मर गया? He had a heart attack. So what to do about heart attack? He was eating cheese and he was fat and obesity, and then from tomorrow I'll start exercising and all. But the moment they come out of cemetery, they start taking ice cream and tea and coffee and gathia and jalebi and everything. So unfortunately, the pleasure is something where a person cannot resist. So if you put some jalebi and fafda here, I know one celebrity, he called me, his sugar was 300, 400, and he called me home. And because, he was distantly related and someone forced me, I went home. And he's telling me, Saab leo, khakra leo, jalebi leo, papada leo. And his sugar is, I saw his sugar is, the assistants checked up, sugar 3C, he said, sir. But then he said one thing, sir, I am going to eat this. Okay, now you treat me. I cannot change, I cannot walk, I will not. So there are people who are like that, and you just can't help it. They belong to those category of 60 and they go. So Apurva, if I have to tell you with my own experience for last so many years, if someone is destined to go at say 75, he will go at 75, destined to. What I can do or what I can help him is from 60 to 75, I can give him a quality life. No doctor can increase quantity. No, you have to go, you have to go. Then you will see some people at 30 have road accident, die. Okay, so they are destined to go because of road accident. Same way, if you are destined, this is what destiny, I believe in God that way, that God has given you certain life, whatever is your period. Now, there is another way to look at it, that if someone is destined to die at 95 and he develops paralysis at 65 because of wrong lifestyle, okay, he will live till 95, but those 30 years are very bad. Okay, it's better to die rather than live that kind of a life which is very handicapped. Even if you have to clean your backside, you need some help. A very, very dirty lifestyle. So I would personally suggest that the healthcare or probably lifestyle should be educated or should be put forward to all the people. Give some 10 minutes and to the patient, to every doctor. Now what happens here, when you go to a doctor's clinic, the moment you say I've got headache, they start taking pen and write it down. Now this is wrong, some painkiller, whatever, XYZ. They don't go into the details of that, or they don't even ask, are you smoking, are you having a problem, you got interpersonal relationship, you got a problem with your wife or your brother or your parents or any, or at job or whatever it is, because that could be one reason for his headache. So your tablets are going to spoil his kidney and he will be addicted to those. You can see how these people get addicted to smoke and alcohol. I've got a beautiful study of many patients. I study them. Initially, they start with some family dispute, some problem, either with spouse or with brother or parents or school, and they feel depressed for no reason, primary reason. They feel depressed. अरे मेरे को इसने ऐसा बोला, my brother insulted me, my wife did this, which is a reaction of those people to their actions actually. They are not supposed to get depressed or upset or anxious. but they get because of psychological issues or their own personality. Now, these people, this particular gentleman or boy, he goes out and looking depressed. So his friends come, kya ho gaya? No, I know this, that. Arey, kuch nahi, nothing. They don't have anything to offer him medically or otherwise or counsel or like nothing. So they, arey, chalo, chalo, mere saath, we'll enjoy. They go to party, they give him a smoke, and he feels little better with that smoke and alcohol. So automatically for him, this is a treatment. So the next time he gets upset, he gets depressed, he's taking that cigarette and bought a glass of alcohol immediately. And then it happens so routine that even if there is no problem, he'll start. So it is like there is a Gana, ne? Dukh, gam mein bhi pi, sukh mein bhi pi, something like that. So then it becomes habit. Then that habits cannot break. Then you see that which was the fellow actor he was. So he was in a mess, and then then finally their minds become so dirty that they just can't sleep in spite of alcohol, in spite of, and then they go to drugs, and that's the ultimate things. And I have seen a person in my practice. I was surprised. He was taking all these things, drugs, ganja, charas, everything, brown sugar, everything. He was PhD in that. And lastly, he was going to a person who with cobra men. So cobra used to bite his tongue. Can you imagine? I just the parents told me, and he used to pay 500 rupees to the fellow for one bite of cobra on the tongue. You can die. This fellow was. So that kind of intoxication I've seen, because it just keeps on going and going up and up. So idea is, if these people, rather than giving medications, if they were given a proper lifestyle by a lifestyle coach, probably they would have survived. So why now your next question would be, why then not lifestyle? And there are many lifestyle people, alternative medical people are required. But I was talking to someone in Colombo. He is expert in acupuncture, and he told me a humorous thing, that a person uh, came to him and he said, well, look here, I'm this, I'm that. And then he said, why this much cost? 500 what? So then people were not paying him. So he told me a joke that he called a plumber, and plumber repaired the problem, fixed up the whole thing, and the tap started. And then he said, how much? He said, 5,000. I said, 5,000? I am a doctor and I don't charge, I charge only 500. He said, I was also a doctor few years back. So unfortunately, these alternative medical people, for whatever reason, people will go to 5-star hospital and pay quite a decent amount. But these people who actually tackle your lifestyle are not paid so much. And that's why this particular pathy is dying. This sympathy is slowly wearing down, which is most important. And that is what I would suggest the modern doctors, the hospital, at least have a specialty called sympathy. You have specialty of homeopathy and naturopathy and allopathy, but this sympathy is very, in whatever specialty you are. So that is why my earnest request to people: have lifestyle, have your habits removed by some lifestyle consultant, and see to it that you reach that target of 90 and 100 of life with full health, full vitality, full energy.
Thank you, doctor. So I feel that what you just mentioned, that patient history is very, very important before treating them. And every time for a smallest thing, instead of being anxious, it's better to analyze things and then
Very true.
consult a doctor.
Absolutely.
So, doctor, let's get a little curious. We'll have a what if segment. I'll be just giving you some scenarios, some hypothetical questions. Ki, what if this happens? What would be the outcome? So, to begin with the first question, What if everyone adopted holistic lifestyle change since childhood, and how that can change the future healthcare?
So Apurva, medicine, if I have to, analyze, is art, science, and commerce. So when I started my practice somewhere around 1976, medicine was an art. We didn't have much of the gadgets. We didn't have even sonography at that time. So it was just your perception, your clinical judgment, and we used to treat patients, and patients were getting all right. So our hand was sonography, our eyes were MRI,
X-ray.
X-ray. So after say 85, somewhere around 85, all these gadgets started coming, sonography and MRI and CT scan and blood test and all sorts of things, they started coming slowly, and the science was added to that art. So we could confirm our diagnosis. Yes, there is a stone here. We could do sonography and find out, yes, your judgment is art and sonography is a science. Say, for example, tumor. Your judgment is tumor, and when you do MRI, you confirm. Your judgment is heart attack. You do your ECG, you confirm. So, art was confirmed with science. And after 95, somewhere around 2000, these two things vanished and commerce has taken over. So which I have not learned, unfortunately. But then, the art, science, and commerce, this trio today, where art and science has taken backseat and commerce is quite up on the ladder, and you see this all these corporate people and all. Finally, their idea is not to treat the patient, but to treat the pocket of the patient. So that is unfortunately a change which has happened, drastic change which has happened over a period of my lifetime, and I don't know where we are going further. So this is number one. Now number two, what you said was lifestyle changes adopted earlier. Now what happens, what I've seen in last 20-25 years, that the mothers, most of them now, they get, first of all, they get married quite late, say 30 plus. I have yet to see someone who is getting married at 20 and 21, and that era is gone. So these 30 plus women, uh, most of them, I mean, in my practice, what I've seen, whether they say yes or no, but they are smoking, they are consuming alcohol, they have got very erratic lifestyle, getting up late, sleeping late, all these gadgets, till late night and whatever, exposure to screen and all. Now they get usually infertility, and then most of them they conceive with IVF. So when they conceive with IVF, I have still know one mother. She came and asked me, I have conceived now, but I cannot leave the habit of smoking. I said, you will have to leave. So he said, if I from 20, if I make it down to say 5 or 6, I say whether 5 or 6, the oxygen is going inside. Along with oxygen, your smoke is going inside, carbon monoxide, and that is going to be toxic. So if you are taking too much of poison, your kidneys and liver both get damaged. If you are taking less poison, only kidneys will get damaged and not the liver. But you will have to understand that. But unfortunately, fortunately, she had miscarriage and whatever. Blah. So that's number one. So lifestyle changes or this kind of problems start with the womb. The moment you become pregnant, the child is in the womb, and if you cannot manage this lifestyle, better not to reproduce or rather give birth to a child, because those issues are going to damage your child. That's number one. Now come and see, the child is born, okay, and mother, the moment 3 months and 4 months, and they say come to you and अभी milk बंद करो, क्यों, हमको ऑफिस जाना है, I want to give bottle pill and I want to give formula milk and all sorts of things. This decreases because mother's milk is highly concentrated as far as immune things are concerned. So if those immunity is not there, they are vaccines actually. Mother's milk is a vaccine. So if this immunity is lacking, the child is going to be sick. Child who is going to be sneezing, is going to get allergy, is going to get cough, cold, everything. So that's number two. Number three, the moment child becomes 2 years, 2.5, 3 years, not even 2 years, I mean less than 2 years, I've seen, they start putting them in nursery, some classes, some. I know one mother, Right from the child comes from the school at 1 o'clock, 2 o'clock, and by 3 o'clock, child is going to drawing class, and child going to swimming class, and child is going to skating, and it's so multitasking. I've never thought of it. At 2 years, the child is going to all these things, and they compare. This child is doing very good in painting, so my child has to do. It's not compulsion. It's not possible. If someone's child is good at music, you can be good at music, but you cannot be good at. So you can't put your child into music and painting, and this is horrible. That's number three. And number four is, nuclear families, which we have right now. We are following Western countries, and these nuclear families, they have lack of parenting, meaning the child, both husband and wife working, child is with caretaker, with ayah, whatever it is, grandparents are not there, and these grandparents' love and affection is too much in the absence of parents' love. But unfortunately, that is lacking. And that is the root cause of adult problem. So I would suggest that you have to strike at the bottom. And if that is done, I think your question is answered.
Nice takeaway, doctor. Now, second question is, what if doctors prescribe lifestyle changes before medication? How will that affect?
So if that happens, Deepika, all the corporates, hospital, all the pharmas will stop. But that is not going to happen. You're kidding me? If doctor starts doing preventive medicine, what you are talking, and you have taken a very good initiative of that, I'm very happy that one fine day this produces, or our efforts produces, a good color. Uh, I don't foresee in the near future. Pharma lobby and corporate lobby, corporate hospital lobby is very powerful. So you are in the clutch, and I would suggest that yes, it should be initiated quite early. Uh, if I have to tell you something, that when I was in London, one of my friend who is a professor of medicine, and he told me jokingly, that of course in a lighter note, that you, when you are sick, okay, take a car, taxi, and go to the hospital, because automobile industry has to survive, or transport industry. Then doctor writes a prescription, take that prescription, because hospital industry has to survive. Then take this prescription to the pharmacist, and take the medicine, pay him, because pharma industry has to survive. Then you go home and put that medicine box in dustbin, because you have to survive. So this is the, of course, on a lighter note, but this is the reality. Idea is to take minimum medications and maximum lifestyle. This is why what we call it as holistic medicine, where maximum portion is holistic. That is why the whole thing, that's called holistic. So maximum treatment, say for example, out of 100, 75 to 80% should be holistic medicine, and 25% should be modern medicine. Modern medicine is very good. It's not, I don't condemn modern medicine. I am a modern medicine doctor. But wherever it is utilized, say for example, you got a machine gun, okay, and you got a foot ruler. Now there is a mosquito and you want to kill the mosquito. Use the foot ruler, you can't use machine gun. So lifestyle holistic medicine is a foot ruler. Doesn't do much of the damage. But if you use machine gun to kill that mosquito, or I use that machine gun, I can kill all of you. Mosquito may die or may not die, but all of you will die if I use machine gun wrongly. So this is what I my personal plea on this particular ground.
Doctor, still there is a stigma about mental health. So, what do you feel? What if mental health is given the same importance as physical health? Will something change because of that?
Naturally. So basically try and understand that mental health is neglected. The moment if I tell someone from the audience that you are mentally ill, first of all, he is offended. You getting me? He said, can I? I'm not. Because then I tell them that look here, the President of United States, Bill Clinton, had to undergo mental health care. So who are you? He is running the topmost thing, the world leader basically. But if he had to go, so mental health doesn't mean you are mad. Mental health means you are deviated on a particular route. So if you are deviated on that particular route, say for example, I just now deviated, I went to some other, you corrected me. So that doesn't mean my mental health is bad, but yes, I was deviated. Same thing, you can deviated physically. I was deviated physically on the route. They were deviated mentally on that, and otherwise their other faculties are very good. He was running a big state like United States. So there is nothing wrong in taking help. Now, the issue is what, that if you have to understand little, go into little deep, the mental health is a genesis of physical health. How? I'll tell you. The mental health usually starts with a conflict. The conflict between husband and wife, conflict between the parents, brother, sister, in the society, with the neighbors, and broad term with the national or international level, whatever it is, wherever it is a conflict. This conflict troubles you. When this conflict troubles you, again go back to that example which I told you about the child. The moment the conflict comes, automatically the smoke comes, automatically the drink comes, automatically the junk food comes, automatically the and all these things will lead to obesity. This obesity will lead to diabetes, blood pressure, cholesterol, and this trio, deadly trio. Diabetes, blood pressure, and cholesterol, they are deadly trio. This trio will cause heart attacks, it will cause stroke, can cause gangrene, and more or less it can give you morbidity and mortality. What is mortality? Is death. What is morbidity? Gangrene, you are just bedridden. Heart attack, you are bedridden. Stroke, you are bedridden. This is called morbidity. So if you can control this conflict and give a clear idea about mental health, that's why now we don't say that you need treatment, we say that you need counseling. Say for example, one of your own friend, she was a doctor, but she needed a very good counseling, and this is a disorder. You have got physical, you got typhoid, supposing I got pneumonia or I got influenza. Are you feeling sorry for that, or are you feeling shame on it? No. Same thing, the mind can have problem. The problem between a machine and a human body is only one. Machine, even if cannot be repaired, you try to repair, it can be repaired. In the same process you can repair. There is no different process of repairing this and this, same thing. But human being, where it comes different things. A person can be treated with lifestyle, person can be treated with in ICU also, extreme. So this particular thing, this issues of treatment here, the lifestyle has to be so, as I said, it starts in womb, the problem. So if a mother is smoking, that carbon monoxide is going to affect his brain. Now if he becomes an adult, how he will react with his wife, how he is going to react with his son, how he is going to react with the society, how he is going to react with his brother, absolutely depends on the carbon monoxide is inhaled during the pregnancy or in the womb. So what you saying is absolutely right, that there is called genetic and there is called epigenetic. Genetic is you can't help it. Now my father has diabetes, I can't help it. Epigenetic is environment. So I created that environment of smoke in my womb, and then my child is going to suffer. That can be, so epigenetic can be prevented, genetic is not. That is what one should take care of.
Now let's talk about some commonly seen social trends on social media. What's your take on that, doctor? We generally, hear a lot of things going on social media. People follow Instagram and Facebook and all with these trends and try and adopt them. So, what is your take on that? First is intermittent fasting. So, what's your take on it? It should ideally be tried, or it's a trouble?
So any kind of fasting for that matter is good. Any kind of fasting. Say for example, we fast daily. We sleep in at 10 o'clock, get up in the morning at 6, 7 o'clock, 8 hours. We don't eat anything, isn't it? So that's fasting. That's intermittent fasting automatically, which is given by the God Almighty. So now this intermittent fasting, what you are talking, is an extension of that natural fasting. So as I said, intermittent fasting or any kind of fasting in Ramjan, just now Ramjan is completed, and or our we have Ekadashi and whatever, and there are all over the world this fasting is prevalent. Monday fasting, this is actually a cleansing of your body. It's required. However, this applies in a healthy situation. But in unhealthy situation, sometimes it becomes a problem. Say, for example, just a few days back, I had a call from someone, and they were fasting, and she said, "I'm feeling giddy," and sugar was somewhere around 60. So they were like, some people are motivated on, as you said, social media, these, that, WhatsApp universities, and all. So what I have seen, I've gone through this kind of videos. Now, any Tom, Dick, and Harry, there is no qualification to go on to social media. So, any Tom, Dick, and Harry, they will put their post, whatever they feel. You understand, whatever is them affecting them. So, if supposing this guy is smoking, he will encounter 10 benefits of smoking. He will. And then someone who wants to smoke, okay, will see this video and even propagate to others. So there has to be some regulations of this social media, and the person has to be qualified to put their videos on social media. Otherwise it is going to create havoc, I'm telling you, because followers are fantastic, they are blind followers in many of time. So if you see, I don't want to name that guru, but he was propagating everything. तुम smoke करता है, yes करो. तुम drink करता है, yes करो. तुम लफड़ा करता है, yes करो. He was stamping. So what these celebrities they needed was stamping. कि मैं लफड़ा करता हूँ, yes, they गुरुजी बोलता है करो. So they like that Guruji and they give everything to that Guruji. You getting? But unfortunately, of course, that Guruji is no more. But this is what happens, you know. So now that Guruji is replaced by social media gurus, and there should be some restriction. There should be some control on it.
So, doctor, you're saying that the intermittent fasting is good, but it should be properly monitored
Naturally.
and under the guidance of some either a life coach or a doctor. It should be done.
If you are suffering from certain diseases, if you are healthy, no any fasting, no problem.
Okay, doctor, what about juice cleanses? Nowadays, there's a lot of detox juices and fruit juices and smoothies and everything. So there are most of the people only on juice cleansing thing. So is it actually needed? Is it healthy? What is your take on that?
So this is a money making gimmick. So tomorrow, supposing you are famous on this social media, Instagram, whatever you told me just now, and you want to then start your juice center, whatever, XY, Devlari, say for example, you will get lots of followers. And but only thing is that you have to put yourself as Apurrva, Dr. Apurrva Juice Center, and all these videos and all, you'll become famous. So you see, there's yogas, right? Yoga is yoga, isn't it? Now what Shilpa Shetty did, Shilpa Shetty's yoga and one cassette and all, and then people started, instead of putting this leg 20 degree, you put at 30 degree, that becomes your yoga. You put your name. Now, all these juice cleaning and all this whatever XYZ things, they are absolutely, I don't advocate. On the contrary, juice doesn't have a fiber. Juice has lots of sugar. Your sugar increases. You do not have fiber. And juice is most dangerous because finally, instead of cleaning, it dirties your mind because you get so addicted. Addiction is not for alcohol and smoke. Addiction is for juices also. And when you take lots of juices, they have found that these people get really constipated. Their sugars are really high, especially those who are diabetic. Their sugar jump up and they'll end up in ICU. So I would suggest you have to have juice once in a week, once in a while. You can have, but not like daily for health purpose. Absolutely wrong.
So again, the concept of what we want to consume should be rightly understood before we go ahead with that.
That's true.
So that as you rightly said, juices have more of sugar, less of fiber. Fibers are very, very important for our health. So I mean, it can be. You can't stay on a juice diet every day.
In fact, fibers take away your sugar from your guts. So fibers are good for even reducing your sugar.
Correct. Doctor, the third trending social media trend that we see is ice baths and cold water shower. So, what do you have to say about that?
So there are some reports from Western countries that ice baths are good, but I would suggest one thing, that never go to extreme, because we have seen this kind of ice bath or throwing ice and all. People have died because of cardiac arrest. Why? I'll tell you. that this ice or ice cold water, whenever a person has got tachycardia, what we call it a supraventricular tachycardia, where your pulse goes to 140, 180, 200, 250, 300. Now, in this kind of situation where pulse is 300, heart pumps like machine, fast machine. And when you want to reduce this heart rate, okay, you throw cold water and the heart rate comes down to 80, 60. Now, if from 300 heart rate is coming down to 60 or 80, just imagine a person has already got 80 heart rate and you're throwing water, it will become zero. So this is called cardiac arrest. So you have to utilize this kind of things very, very judiciously. Don't just use it randomly, because you can kill a person or put a person in ICU.
Okay, so again, as we've seen all these trends, so the trends are actually not bad, but you should know how to use it
That's it.
correctly and under the
Absolutely.
guidance of some experts, so that you don't get the adverse effects of it.
I fully agree. Rightly taken.
Doctor, now it's time for some rapid fire questions. So I'll just pose some questions. You let me know whether they are the myths or the facts, and what is your take on that?
Fire.
Okay. First, do you need to drink 8 glasses of water every day?
So in a healthy situation, if you are healthy, yes, 8 or 10 even, no problem, because your kidneys are functioning very well. But in some people where they have heart problems, the heart failure or kidney failure or organ failure, then you have to restrict that particular water. Don't go like that. And especially on social media, if a person doesn't understand that his kidneys are not functioning well, his heart is not functioning well, and still they'll end up in ICU. So very judicious use and very intelligent use of water.
Eating fats make you gain weight.
So I would suggest one thing, that there are two kinds of fat. One is saturated and unsaturated. Unsaturated again divided into polysaturated, monosaturated. But finally you have to understand that you don't take saturated fat. What is that saturated fat? How do you, there are questions to me whenever I give lectures to audiences in Lions or Giants Club. They ask how do we know saturated? So simple thing is, the fat which is liquid at room temperature is unsaturated, and fat which is solid at room temperature is saturated. So if you see the butter is absolutely, butter is thick at room temperature, right? So that is saturated, that you are not supposed to take. But if you see the oil, say coconut oil, is liquid at room temperature, that's good for you. But again, having said this, again it's in a limit. You just can't take it randomly. So the whole idea of all this, whatever are your rapid questions and whatever the use, finally if you are healthy you can do anything. If you are unhealthy, you can't. Say for example, I can lift 30 kg. Okay, I can lift 30 kg. You start lifting 60 kg, doesn't mean I will lift 60 kg. So individual to individual there is a lot of variation.
Okay. You shouldn't eat after 8 p.m. Is it true?
So ideally, yes, ideally it is true. You should keep your stomach healthy. You can get a very good sleep. But again, having said that, there are people who are doing night shift, there are people who are doing day shift, there are air hostesses, there are pilots, they've been working. So there is a jet lag. So it's a heavy variation. Again, the principle is, before you go to sleep, 3 hours before, because the digestion time is 3 hours. 3 hours before you take your meal. Say supposing you are going to bed at 11, then 8 o'clock. If you are going to bed at 10 o'clock, then it is 7 o'clock. So if you see the Jain mythology, Jain religion, they usually take it at 7. And I would suggest that this particular principle from this particular religion, one should adopt if it is a regular lifestyle, not erratic lifestyle.
So, doctor, that means all these, we are describing it as a myth or a fact, but which should be rightly understood before following the trend, I feel.
Absolutely.
Absolutely. Thank you. Dr. Shah, thank you for being here today with us, and it was, great information exchange that you shared with us. So many new things that we've learned. Any last takeaway that you will tell us, audience?
So I'll say, Sarve Santu Bhavani, Sarve Santu Niramaya. All of you get all right, healthy, be happy, And one more thing which I would love to add here is that the health is not just the absence of disease. Say, for example, I'm talking to you. I'm healthy. I don't have diabetes. I don't have blood pressure. I don't. If you see, everything is normal. But if I am not happy, there is something wrong. Okay, uh, emotionally or psychologically, then I'm not healthy. So, what is health? Is emotional, psychological, physical, and spiritual. If I'm healthy in all four ways, then I'm healthy, not only physically. So, otherwise, if psychologically I'm upset, automatically over a period of time, spiritually I'm upset, automatically over a period of time, I'm going to be sick. I'm going to be affected by sugar, blood, all these things, they are affected. All these lifestyle disorders, they are affected with stress. So finally, ideology and what I want to tell people when I say Sarve Sangu Bhwani means you should be happy. They have to understand why should we be happy and how should we be happy, because that is also important here. And understand one thing, as far as physical disorders are concerned, 10% of the people are diabetic, 20% of the people are obese, 30% of the people have blood pressure, 40% of the people they have dyslipidemia, that means cholesterol, high cholesterol, and 50% of these people, 50%, very high staggering thing, they have depression and anxiety. So out of 5 here, at least 2.5, we have some degree of psychological disorder. So if you can understand, the audience understand this, that yes, there is a psychological problem. We have, they explore, they have to go home and find out, yes. And if they can understand and probably either themselves or some lifestyle changes or with the help of some doctor, if they get all right, I mean, if they can correct that psychological disorder, their future problem of physical disorder or what we call it NCD, non-communicable diseases like this, they get corrected. And if they can correct that, their chances of getting heart attack, their chances of getting
Stroke.
stroke or asthma or even arthritis or infertility, what I told you, and cancers, they become very very less. So friends, what I want to tell you is that you get you remain healthy all throughout 100 years of your life. uh, the key of your health is in your hands. Okay, I have told you how to use that key, but the key finally is in with you, and you must know how to use that key to open that lock to remain healthy forever. And I wish you a good luck forever. Before I end, I want to tell you a small thing where there was a conference of orthopedic doctors, big conference all over the world. Leading orthopedic surgeon, they came, and after the conference, they've started on the just for a walk, and they saw someone coming from the opposite side, and this fellow was limping, So they were discussing. Someone said, one orthopedic surgeon said, he has got TB of spine. Someone said, no, 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 he has got fracture. Third one said, no, 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 he has got cancer. Fourth one said something. And that fellow came closer. And everyone said, you got a problem, we have got an orthopedic conference, we show you and then we'll do it free treatment and all. Say, what happened? I don't need any treatment. No, no, you are limping, you got some problem. No, nothing, no problem. Then why you limping? He said, my chappal is broken. So this is this is what medicine is. Okay, so before you consult a doctor, see to it that your doctor is capable of handling the situation both physically as well as psychologically, and he is using more of lifestyle and less of medication to avoid all the heterogeneity, all the ADRs, that is adverse drug reaction. Thank you very much. God bless you.
Doctor, I would say the message that has imprinted in my brain today is health is lifestyle, lifestyle and lifestyle.
Absolutely. That's what I started.
If you've enjoyed this episode, please do like and subscribe to the episodes of What the Health. Stay tuned for more such unfiltered informations about health. Stay healthy, stay curious.